All right, good morning, PTNI's daily show. Happy Friday morning. I hope your day is off to a great start. My name is Al. I'm happy to be your host today. Currently have the pleasure of serving as the Chief Operating Officer here at ICE and a lead faculty in our Fitness Athlete division. It is Fitness Athlete Friday. We talk all things CrossFit, powerlifting, Olympic weightlifting, bodybuilding, endurance athlete, running, cycling, that sort of thing here on Fitness Athlete Friday. We would argue it's the best day of the week. Today's topic, we're going to talk about compression therapy, different modalities for compression, for swelling, post-op, that sort of thing. Before we get into today's topic, I do want to talk to you about a couple courses coming your way from the Fitness Athlete division. Some live courses. You can still join Joe down in Peoria, Illinois this weekend for Fitness Athlete. It's not Fitness Athlete Friday, Fitness Athlete Live Seminar. That course still has some seats left. If that doesn't work for you, the weekend of November 3rd and 4th, you can join Mitch out in Twin Falls, Idaho. The weekend of November 12th and 13th, you can join Mitch down in Baton Rouge, Louisiana, or you can join Zach Long out in Bellingham, Washington. And then your last chance to catch us out on the road for Fitness Athlete Live will be the weekend of December 3rd and 4th. Mitch will be out in Santa Barbara, California. And your final chance to catch us online for Fitness Athlete Essential Foundations this year will be November 7th. That will actually be our last cohort until sometime in the spring. That course is going to run through the new year and end in the first week of January. And then I will be taking some time off for some paternity leave. So we will not be firing that course up for about 5 to 6 months after the last course begins November 7th. So if you've been looking to get into that course, November 7th is going to be your last chance for quite some time. So make sure you grab yourself a spot. That course always sells out a couple of weeks early, so grab it sooner rather than later. Today's topic, compression therapy. We had some requests come in to talk about the different types of compression available out there. What do we do in the clinic? What do we do with our athletes? What's the research say regarding compression? So I want to talk to you today about a couple different topics. I want to talk about different types of compression. I want to talk about how we measure recovery, quote unquote recovery. What does actually recovery mean, both practically in the clinic as well as when we're looking at what the research says about these modalities. And then I want to talk to you about the clinical value and what we use here in the clinic at Health HQ, what we use in the gym at CrossFit Fenton, and how we kind of use the research based upon what works for our athletes and our patients. So first things first, we need to touch on what are the different types of compression available, because they're not all created equal, and that's really important to know. When we are looking at compression, we're measuring it as compression in millimeters of mercury. And we need to know that the compression, the actual compression on the tissue varies greatly depending on whether we're using our hands, whether we're using a static knee sleeve, calf sleeve, some sort of compressive sock or stocking, and then the more aggressive intermittent pneumatic compression or IPC. So starting on the low end of compression, we need to go back to our manual lymphatic massage and talk about the compression there. Now, manual lymphatic drainage is very light compression intentionally. We're thinking about that light compression, about 10 millimeters of mercury, that's just targeting the lymphatic system and trying to flush the lymphatic system out and clear some of the fluid in the lymph system. So we learned this in school. Those of you who are maybe lymphedema certified specialists, you're very familiar with this. Probably most of us in the orthopedic realm do not use this regularly, but we need to know this is light compression. The goal is not to squeeze or really press. We're not thinking a rough massage. We're thinking an intentional light massage. The idea is if we give too much compression, we can collapse those lymph vessels and nodes, at least temporarily, and actually work against ourselves. That if we give too much compression, we can actually halt the drainage of that fluid naturally. So the pressure there needs to be intentionally light. Again, what do we think that is? Some studies showing about 10 millimeters of mercury of pressure. So again, very, very light pressure. If you think about that blood pressure cuff pumping up to maybe 120, 150, 200 millimeters of mercury. If you've ever used blood flow restriction in the 100s, the 200s of compression there, you know that's heavier. 10 by comparison is very, very light. So that's our manual lymph massage compression. Stepping up from there, we have some intermediate options. We have static compression. These are our knee sleeves, our calf sleeves, our stocking compression. These are always compressing at a light to moderate grade. Things you can buy over the counter, starting from about 15 millimeters of mercury pressure up to about 40 millimeters of mercury pressure on the heavier end for a more compressive full leg stocking or calf sleeve, compression sleeve. We see those a lot in our endurance athletes, or maybe some sort of Tommy Copper type knee sleeve, something like that, to deal with maybe some more chronic swelling. So there the pressure increases. There we're not thinking about draining the lymph system. We're thinking probably some sort of chronic local swelling. The compression there might not be for swelling. The compression with these might be for cramping. It might be for discomfort with activity. A lot of the folks wearing a calf sleeve and running don't often deal with calf swelling. They might deal with calf discomfort during the run, and that compression, that heavier compression, can make them feel better. Here with things that we wear, we can get a little bit heavier as well. We can do progressive compression. These are the wraps that our lymphedema specialists are often doing in the clinic. They're getting more prescription grade compression. They're often making custom wrapping, and they're often doing distal to proximal wrapping. Again, the goal here with that is to actually clear out some swelling, usually chronic swelling. And then on the high end, when we think about 10 millimeters of mercury with our manual pressure, then on the opposite end of that is the intermittent pneumatic compression, things like Normatec or rapid recovery boots. Those often boast pressures of 100 millimeters of mercury or higher. So again, much higher grades of compression. We'll show you that here in a second. We have a pair of Normatec boots here at the clinic. And then I want to talk about some different ways to deal with swelling, whether it's for an injury or whether it's for recovery. That's a little bit outside the box. That's maybe rethinking how we use compression therapy. So my second point here is, what is recovery? Quote unquote recovery means a lot of different things to a lot of people. It's important to know measuring recovery in the research, yes, uses subjective terms, uses subjective measurements of muscle soreness, readiness to train, but also the research does measure recovery from an objective standpoint, measuring things like degree of muscle damage, how much creatine kinase is in the bloodstream pre and post interventions with these modalities, how much muscle glycogen is available pre and post with these modalities. Does using these compressive modalities actually facilitate true objective recovery? Do we actually have more chemical energy available for exercise after using these? Do we actually flushing out these byproducts of muscle breakdown the way we think we are with these compressive devices? Yes or no? So the important thing to recognize as we move into point 3 here is that the research is not very robust in this area. All of these different devices that you can buy, compressive boots and sleeves and pumping things that you sit in on the couch and all these different kind of massaging, pumping, compressive devices. What's interesting is they all have quote unquote research backing them, but if you look at it, it's research conducted by the company, by company employees, usually on other company employees. So stepping back away from that biased research that has a huge conflict of interest and looking at the current body of literature, published literature, we find very few studies that look at these modalities, but there are a couple available, and I want to talk about those. The important thing to note is these devices, in the span of scientific research, are relatively new. There's only about 10 years of research available on these devices, so you're not going to find some landmark study from 1968 like you would with some areas of performance and science. These, again, are relatively new. So a handful of studies here we'll talk about. Keck and colleagues from 2015 from the Journal of Strength and Conditioning Research looked at folks who did a 90-minute cycling ride. They had muscle biopsies performed. They were using intermittent pneumatic compression, so something like the Normatec boots. I want to stop and show those real quick. If you haven't seen those, if you're on the podcast, this makes no sense to you because you can't see me, but check out the video on Instagram or YouTube. This is what a typical intermittent pneumatic compression boot looks like. This is a full leg sleeve, so this will cover from the foot all the way up to the hip. They also have them now for your arms that will cover your hand all the way to your shoulder for upper body swelling and recovery. So if we look here closely, we can see the stitching here. This sleeve here will start compressing around the foot. It will then move to the next section of stitching. It will build pressure in the foot, hold it. then build pressure around the calf, hold it, build pressure up across the knee and hold it, then build pressure through the thigh and hold it, and finally build pressure around the hip and hold it. So it's sequentially building and holding pressure up the leg. The idea there is that it's going to press fluid, blood out of your foot to your calf, out of your calf up and around the knee, out of your knee up and around your thigh, out of your thigh up and around your hip, and into the big blood vessels and lymph vessels of your hip, and ideally back to your heart. And usually you are sitting in a gravity chair with your feet elevated above your heart while this device is pressing on your leg. And the idea is you're getting a passive blood pump back towards your heart that's going to cycle the fluid back. After about a 5-minute cycle, it's going to relax. That blood is going to come back to your foot, and then it's going to pump again, and you're going to go in cycles like that, cycling the blood back and forth out of your leg or your arms back to your heart and then back down. So that's the idea behind intermittent pneumatic compression or sequential pneumatic compression. So back to the study, Keck and colleagues looking at intermittent pneumatic compression with these cyclists, 1.5-hour bike ride, looking at muscle biopsy, given 60 minutes of compression after the cycle ride, having a muscle biopsy taken, given another 60-minute bout of the compression, then another muscle biopsy, and then waiting 2 more hours and having a final muscle biopsy. The goal of this study was to see, does this device aid in any way in muscle glycogen resynthesis? Does pumping this blood back to our heart facilitate turning that lactate byproduct of exercise back into pyruvate and back available in our bloodstream to use for cellular energy? And the study found no, it did not. There was no difference in muscle glycogen resynthesis in the group that used the pneumatic compression boots versus the group that did absolutely nothing. Another study here, Hahn and colleagues, 2017, looking at folks now, instead of a long endurance ride, folks who did high volume, high load back squatting. Same idea here. They used intermittent pneumatic compression boots, compared it to sham. And they looked at, here they were looking at, does the compression boots mitigate the standard reduction in muscle flexibility that we see after strength training? We know a couple-day window after we do high volume or heavy strength training, we know we feel a little stiff. Usually soreness is inhibiting some range of motion, but does jumping in these boots prevent that loss of flexibility? And also, does it have any effect on pressure pain threshold? Does it make the muscle less tender, less sensitive, less sore? Kind of what they're getting at here. Are we feeling more ready to train if we use intermittent pneumatic compression or not? And we did find some changes here. The intermittent pneumatic compression group did prevent that post-exercise reduction in muscular flexibility, and they did have an improvement in pressure pain threshold. So the boots seem to help with a little bit of post-strength training range of motion and post-strength training soreness, tenderness, ability to feel like you could exercise again. It's important here to know that these folks did 3 consecutive days of heavy, high volume back squatting. So definitely we would expect by that second or third day, these folks would not feel good about training, but the boots seem to help with that. They also find that compared to sham, there was a reduction in muscular oxidative stress and proteolysis. So we have less protein breakdown, less muscle breakdown using the boots. So maybe the boots do appear to help with recovery, both subjectively and objectively. And a final study that I like, Stedge and Armstrong, this is from last year. This is from the Journal of Sports Rehab, looking just at a bunch of different studies. This is more a review paper, looking at 2 different randomized controlled trials and 1 randomized crossover trial, and finding that in general, IPC, intermittent pneumatic compression, overall does not appear to reduce exercise-induced muscular damage, although it does, in a lot of studies, appear to improve the perception of muscular soreness. So the subjective interaction of all this exercise, this compression seems to help. People feel like they're less sore when they use these devices. They feel like they're more ready to train when they use these devices. So all that research aside, now how do we apply this clinically? Well, we know these devices appear to help people feel more ready to train. So on a day-to-day basis, does this have much value? I would say no, that if your programming is done correctly, you're basically moving muscle soreness around your body throughout the week, right? You might have a day like we had here Wednesday, wall balls and assault bike. It would be expected that yesterday or today your legs would be sore. So what did we do yesterday? We did toes to bar and power cleans. We did not really train legs again. We trained core. We trained a little bit of lat and grip strength. And then today we had some burpee box jump overs and running and some really light thrusters. So if programming is really dialed in, you're not hammering the same muscle groups day over day. You're being smart with your programming, and that throughout a week of training, you're basically chasing soreness from one area to another. So I don't really see the value in people owning a pair of these boots for home and sitting in them every day. The first thing to know is it takes forever to get in and out of these. It's very time consuming to get in and out of them. You're basically immobile while you're in them. You're on the couch or you're in a gravity chair. You can't really do much but goof off on your phone or watch TV. And it takes about an hour to run through a cycle. So it's important to know the time component and that you're basically immobilized. So if training is done correctly, I don't think these hold much value for everyday folks who are committed to their programming, CrossFit, running, cycling, powerlifting, Olympic weightlifting. I don't think they hold much value there. The next thing to know is the research does not really support objectively that these are helping too much. We're not really preventing muscle breakdown. We're not creating more muscle glycogen than we are normally. So the actual value of performance enhancement is not there as well. Where these really seem to shine is making you feel like you can exercise again. And in my mind, clinically, what do I say there? That sounds like somebody who has a multi-day event. Maybe you're a CrossFitter who has a competition where they're going to be doing 3 workouts in a day, or maybe a higher level CrossFitter who has a whole weekend. They might be doing 5 to 10 workouts across the 2 to 3 day weekend. I think then these boots have some value of if you sit in the boots for an hour after workout, do you feel more like you can go warm up and do another workout? If the answer is yes, then I think these devices have some value to that person. Likewise, endurance athletes, if you're somebody like Dustin Jones, I see Dustin Jones on here, you're somebody who's thinking of doing rim to rim to rim at the Grand Canyon, you're thinking of doing multiple days of an ultra run type person, then I think these boots have some value of when you finish that long run, that 10, 15, 20-mile run, you know you have about 12 hours to eat and sleep and then wake up and start it all over again. Do these boots have some value for that person? I think so. But in general, I don't think these devices have a lot of value. Now, talking clinically with patients with an actual injury, getting away from recovery and performance, do these devices have value? I think that's where these devices really shine. That if we think about somebody who rolled their ankle yesterday at basketball, has a lot of acute swelling in that ankle, and what's going to help that person feel the best and get back to movement right away is getting as much of that swelling out of the area as possible. I think that's where these devices shine. We know, yes, we are using too much pressure to properly clear the lymph vessels and the lymph nodes with this amount of pressure. However, we know that person who rolled their ankle 12 hours ago doesn't have chronic lymphedema, right? They have some acute swelling. They have a true mechanism of injury. We also know that most likely they don't have some insidious underlying disease like cancer that's preventing that swelling from clearing from their leg normally. We're not as concerned about their lymph vessels being flooded or not functioning like normal due to things like chemotherapy. So with those folks, we're mainly concerned with how quickly can we get the fluid out of that ankle, out of that wrist. And the sooner we can clear that, the better that person's going to feel. And the sooner we can get back to normal exercise, normal loading, moving that joint through its range of motion. So I think that is the patient population that really benefits from these devices. And that's where I see a lot of their use in our clinic when they come in of, oh boy, your ankle is so swollen you can't put a shoe on, right? It's January, it's 15 degrees and snowing, and you're wearing a sandal. We need to be able to get swelling out of that ankle so you can get back into a shoe or boot and get back to training as soon as possible. I know in my mind when that person walks in, no matter what we do that day in therapy, we're going to finish the session by sitting in the boots for at least 20 to 30 minutes to try to clear up that swelling out of the ankle. So that's where I see the value clinically. Now, the downside there is the boots stay here, right? They can't take the boots home. The boots are these Normatec boots are about $1,100. Amazon makes some cheaper ones now that are, I think, $300 or $400. The price has definitely come down on these, but these are not a thing that you send home with a patient. They're very expensive. You definitely don't want them to never come back with them again. So the downside is that person needs a lot of help with that swelling in the acute stage. They should maybe be sitting in these boots twice a day, and that's just not possible because they don't own a pair of boots. So what do we do with that person clinically? We use something like this. This is a wonderful device. This is called a Firefly. So this is not compression, but it mimics the effects of compression. It mimics the effects of pumping that blood in and out of the affected limb. This specific device is a peroneal nerve stimulator. So if you're on the podcast, you can see this line. This line goes over the head of the fibula, and it stimulates the peroneal nerve to pump the peroneals, pump some of the calf muscles, get a nice big muscular pump. And I will give these to patients. These are about $10 or $15 each. I think they have a 100-hour battery life. And so patients will go home with these that have acute swelling in the ankle or the calf or the knee, anywhere in the lower limb. And they will wear it at home, and I'll tell them to wear it at home while they're watching TV at night or something. Prop their foot up above their heart and rock this thing for a couple hours each evening, and ideally again in the morning when they wake up. So pump some of that fluid out that has been accumulating during the day at the end of the day, and then the fluid that then accumulates again overnight while we're sleeping and not moving, pump that out again in the morning. And again, the goal is try to get as much of that fluid out as possible. So we send folks home here with the Firefly. So I really like these. These are not an FDA-approved medical device. They have a ton of research on them, but all the research is kind of in the performance realm, not so much in the medical realm. I will tell you anecdotally, I've had a lot of success with people with Raynaud's using this during the day at work to keep kind of passive blood pumping going on in their leg. It helps with that feeling of foot and leg coldness and numbness that folks with Raynaud's get. Any sort of issue with circulation as well. There is some pain relief component to here because we are stimulating the nerve, but mainly I give these out for lower extremity swelling in the acute stage. So check out the Firefly. You can buy these through iDry Needle too. Paul sells these through iDry Needle. You can buy them directly from Firefly as well. The guy that owns the company, Tony, super cool guy, will give you a bunch of research, but will also preface it that these are not medical devices. So don't use them as such. That being said, I do give these to patients to use at home for swelling. So when we can't give a $1,100 pair of compression boots to a patient, this is the next best thing I like. And finally, the most important part with all of this is do a test, retest, right? If you think swelling is an issue, measure the swelling before you do any sort of intervention. Take a measure of the circumference, take a figure 8 measurement, do some sort of measurement, and then check it again after they get out of the boots, after you're done with the Firefly, and make sure that it's actually having a measurable impact on that swelling. If it's not, then it's probably not the modality for that person. When in doubt, remember, active exercise, getting systolic blood pressure up, is the most important thing we can do for swelling, especially in the acute stage. This thing, boots, will not elevate your heart rate. They will not help at all getting your heart rate up. So keep that in mind as well. If these are not having an effect, we need to find a way to get that person spinning on a bike, rowing, doing upper body skiing, seated, whatever that person can tolerate with minimal or no pain to get their heart rate up, to use the big pump, the most important pump, the heart, to start to flush some of that swelling out. So don't forget about some easy steady state cardio as well. So compression, different types: very low manual compression type therapy, intermediate static wraps, heavy compression, intermittent pneumatic compression or sequential compression. What does the research say? It says it mainly has subjective effects. It's mainly beneficial in feeling less sore and more ready to exercise again. So clinically, our application is recovery between events, especially when we have to do a bunch of athletic events in a short amount of time, but also beneficial in the acute stage of swelling. But make sure we have something like this on board, a Firefly, or a way to get our heart rate up at home so that we can continue to manage the swelling, especially in the acute stage, on our own without needing to be in the clinic wearing the boots. So I hope this was helpful. I'd love to hear what you all are doing in the clinic to help with swelling and compression. I hope you have a fantastic Friday. If you're going to be down in Charlotte this weekend with Mitch and Zach, have fun. If you're going to be out in Peoria with Joe, have a great time. Hope you all have a great weekend. Bye, everybody.